conversation that we need to have that you guys need to understand. So, how many years prior to starting your GLP-1? So, we're going to go into part one. How did we get here, guys? How did we get here? If you just joined us, we this is the best number to reach out to my team. We are discussing weight loss stalls. Specifically, we're going to break this down into a four-part series. So, how did we get here? How many years have you been stuck prior to the GLP-1s where no matter what you did before, you couldn't lose weight, or you could lose weight, but you couldn't maintain the weight loss, right? So, the food chatter is the biggest roadblock that we finally identified. In fact, I don't know if you guys saw, but there's an actual scientific questionnaire that's been the food chatter index, I think is what it's called, that actually can allow us to establish some objective metrics regarding how much food chatter an individual might have. So that's pretty exciting. Yes, user 813, we can prescribe. My medical practitioners prescribe all 50 states. So just so you guys know, you can get that from us. This number right here is the best number to reach out to my team. But for how many, 5 years, 15, 5, 10, 15, 20 years, you guys have been on the medications. Uh, the GLP-1 is glucagon-like peptide, guys. The GLP-1 is the peptide that everybody's talking about, the Ozempic, the Wegovy, the Mounjaro, the Zepbound, the Semaglutide, the Tirzepatide, the retatrutide. These are the weight loss medications that reduce food chatter and allow an individual like you to start your weight loss journey. Yes, HSAs cover our programs, guys. We do take health savings accounts and flexible spending accounts, just so you know. Um, for many of you guys, taking the GLP-1 medications were the first thing that reduced the food chatter. Tell me a little bit about what that was like. I want to get some feedback from you guys. What was it like to experience food chatter for a very long time and then finally take the medications and have control over your eating, having control over your eating, not having cravings, not having preoccupied thought, not always being hungry, being able to not eat when you want to not eat. What was that like for you guys? I'm genuinely curious because this is this is going to relate significantly into what we're talking about. 0 interest in eating. Now, we're gonna talk about why this could be a problem here in a second, but just 5, 10, 20 years of not being able to say no to your body. What a relief, right? And this is why I think GLP-1s are integral into the long-term aspect of sustainable weight loss, because if you can't deal with the food chatter, how are you ever gonna be successful? If you can't if you can't figure out how to not eat all the time, right? You're not gonna be successful with any sort of weight loss program, or even worse, any sort of maintenance efforts. And so you take the medications and boom, it's like, "Whoa, the cloud is lifted." Okay, now you need to eat more food. Now everybody who's thinking about when they started the medications and having the impact they did on food chatter, now here you go. You need to eat more food when you're not hungry. Does that screw with your mindset a little bit? Do you guys see how difficult and challenging this is? To now have to eat when you're not hungry after finally being able to not eat when you don't want to not eat. I know that take your time with what I'm saying right now. I'm gonna say it a couple times because this has gotta make sense. 5 to 20 years of not being able to not eat when you don't want to eat, right? Your body's forcing you to eat basically, and then now you start the medication, and now you're able to control the situation. You decide when you wanna eat. which is necessary for long-term lasting weight loss, but now guess what? You're not your hunger cues are completely smashed. Every time you do eat, you get full. You're not thinking about food. Now you have the opposite problem, and you're wondering why you're starving. You're wondering why you're malnourished. You're asking me why I'm in a weight loss plateau. Now you got the answer. You're not getting enough nutrients. You're not getting enough micro and macronutrients. So just as much as the ability to reduce food chatter, we have this now opposite problem where many of you guys are just not getting enough food. And so this is challenging. This is a difficult area to navigate around. And I wanted you guys to understand this sort of background story, this sort of underlying kind of thing in the background because it really does help you guys in the future understand the role of mindset. Struggling to increase my intake. I'm gonna tell you guys right now, if you are struggling to eat, then you're probably on too high of a dose. Now, I'm not talking about diabetics. Of course, this is a sort of a separate category. If you need this to keep your blood sugar at a safe level, but most of us here watching this are not doing this for diabetes. We're doing this for weight loss. And whatever dose your doctor has you on, you're struggling to eat. And I'm telling you, long term, this will never work. If you cannot eat a regular, good, healthy amount of nutrient loaded food, which, in my opinion, guys, probably should be carnivore, which is a whole nother conversation. Um, a lady, I have to, let's see. Here we go. Okay, here we go. Okay, lady, you should be in moderator now, I think. So that's the end of part one, guys. Now you have a deeper understanding of how we got here. Carnivore diet is meat, salt, water, eggs. I'm okay with coffee on the carnivore diet. Any animal product you want, lots of eggs, full fat, lots of butter, ghee. This is the full-fledged carnivore diet. But then we have a sort of carnivore light diet that we will talk about here too as well. If you guys just joined us, welcome, welcome. So my name is Dr. Jones. We're just chit-chatting about lasting weight loss strategies, navigating around the GLP-1s, achieving lasting weight loss, not being stuck on the medications for the rest of your life. That's what I'm here to teach you. That's what we have figured out successfully, by the way, because we do have thousands of people in our programs, in our community, by the way, the Flow Academy membership. And it's really cool, by the way, guys. This community is amazing. There's so much support. And then you have my coaches, my guidance, the structure, and all of the above. And this is what you see from the doctors out there. This is what you see from the community. Bump my dose, bump my dose. Let's go up. Let's increase. That's all you get out there. I think TRT and GLP-1 is amazing. I do. If you need hormone optimization, if you're struggling with symptoms of low testosterone or as a female, estrogen, progesterone related deficiencies, proper TRT therapy can be very, very beneficial. Um, oof. Yeah, if you're allergic to eggs, then just meat. But I'll tell you what ends up happening to a lot of people when they go carnivore is a lot of these crazy allergies end up getting better. Hey, Paulina, welcome, welcome. Depending on what types of allergies, of course, everything's a little bit nuanced and different. But yeah, a lot of people end up reporting improvements in allergies and various medical issues when they remove the triggers, when they remove these roadblocks. So, um, stalled on Monjaro, I had to cycle it. So, the medication reset is a very tricky thing to understand and navigate around, but it absolutely is something that is very, very powerful. Mm, oh, gotcha, Sally. Well, I'm not overriding what your doctors have told you. Yeah, thyroid comes into the equation too as well. Yeah, thyroid is something that you absolutely need to be aware of and you need to understand the implications of it, how to properly manage your thyroid. This phone number right here, guys, is the best number to reach out to my team. So feel free to shoot us a text message with your name and your email and get yourself scheduled for that free consultation. Um, so do humans need that fiber? This previously stable concept that fiber is absolutely needed in the proper human diet is starting to be questioned. It's starting to be challenged because millions of people are not eating fiber, following a carnivore diet, and having massive improvements in their health. So it creates a very confusing situation for a lot of individuals because now you have to make sense of it. Should I be eating fiber? Should I not? My answer, if you're not doing carnivore, then fiber is beneficial. But if you are, then you don't need it. That's what appears to be truth, speaking with many, many physicians who also manage patients and watching myself personally and many others. So again, this is all an area of science that has many years in front of it, and I hope that we can actually get the research that it needs. Yeah, I mean, there are no randomized controlled trials that show fiber is established as necessary nutrients for the human body. We have other research that shows eating vegetables improves health, but then you gotta look at the validity of how they're even defining improved health instead. So, the weight loss stall, guys, we talked about why it happened. So now we can talk next about the science of the weight loss stall, what's happening in your body. Why does it relate to thyroid? Why am I talking a lot about thyroid, and then I'm talking about, um, metabolic downregulation and starving and not eating enough food, like, putting it all together so that you understand the science of it is what I would like to do next for you guys here, so welcome, welcome. If you're watching on YouTube, say hello. I see 13 people watching on YouTube, that's great. Um, I need help over the last few weeks. High dose of tirzepatide. Haven't lost a pound for the last 10 months? Yikes. So, you have 2 problems here. You're stalled, and you're on a maxed out dose, your larger dose. So, we can certainly work with you and help you. My medical practitioners, um, and me and my coaches can help you guys navigate and address these issues. Uh, Debbie Muscles, there's 2 TikTok lives that I'm on right now, so, um, After I finish this series on weight loss stall, if we have time, we can definitely talk about muscles and the implications of muscle mass on your metabolic health. Um, so what happens to the body over a period of time? Hello, Nana. When you start to eat in a caloric deficit over a period of time, your body goes into a state. It can go into a state. It many times does go into a state where your body is metabolically downregulated. So the metabolism starts to slow down. And you don't just have a slowdown in your metabolic rate. You guys can probably think with this, but you're brain foggy, you're tired, you're constipated, you're feeling cold, your body's achy. You feel like crap. I call it zombie mode, by the way. I call it zombie mode because doesn't that just paint the appropriate picture, right? Like zombie mode. I feel like I feel like that paints the appropriate picture. So thyroid is an important hormone to understand. You have trillions of cells in your body, and each cell has receptors for thyroid. Thyroid stimulates, activates the cells, is what activates the mitochondria, which are the batteries in your cells, and the mitochondria are what produces the usable energy, ATP. The very basic subtraits of the food that you consume enter the cells, enter the mitochondria, and crank out ATP, usable energy. So when you have hypothyroidism, how many people watching this are hypothyroid? Whether it's Hashimoto's, whether it's autoimmune hypothyroidism, or any sort of hypothyroidism. I'm just curious how many people watching this are already struggling with hypothyroid. No, you cannot download the TikTok app, which is so funny. It's crazy. So there is a good morning, life's journey. Welcome, welcome. There is crossover between hypothyroidism and starvation mode, right? So the crossover is are these symptoms of hypothyroidism. Tiredness, brain foggy, constipation, feeling cold, achy body, hair loss, many, 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 many symptoms of a hypothyroid. So now in the situation where you're not getting enough food, the solution is simple. You don't need medications. You got to eat more food. And we're going to talk about that here when we get to that part of today's conversation. Fixing the weight loss stall, fixing the metabolic down regulation. How do you fix it? You fix it by eating more food, by consuming more food over a period of time. You can begin to upregulate metabolic function and come out of starvation mode. Or you have hypothyroidism and you need medication. And so this is why we do when you work with us guys, we do a comprehensive blood panel. We're looking at free T3, free T4, reverse T3, of course, TSH. We're looking for inflammation. We're looking for insulin resistance. We're checking out these various markers because we need to identify, are you in a weight loss stall? Do you just need to eat more food or do you need medication? Many of you guys are on medication and you're still not losing weight. You still have hypothyroidism. And that's kind of a separate issue. Standard thyroid care just doesn't, it's not that good. They're looking at a very uh, narrow, I won't say narrow, but there's a lot of people that go undiagnosed in standard medicine because they only look at the TSH. And this is the situation. Doc, I feel like crap. Mrs. Jones, your labs are fine. You don't have hypothyroidism, but you have all the hypothyroid symptoms. But we will help you address that if you guys work with us, get the lab. The weight loss panel that we do is very, very powerful. Al Carafi increasing your GLP-1 dose to address the stall is not the way that I would go about it. Most people are told to increase their dose to get more weight loss. Most individuals are told to increase the dose to get more weight loss. But you know what's crazy? The research was only done on GLP-1s. The only research they did was using the GLP-1 medication as the only variable to trigger weight loss. They weren't doing research on GLP-1s with fasting and GLP-1s with eating low carbs and none of that other stuff. It was one variable. How do I keep producing more weight loss? Keep cranking the dose up. So that's why these obesity doctors are so confused and baffled when our clinic keeps them on lower doses. And yeah, there's no literature that says stay on a lower dose, but do you really need a research study to tell you if you're losing weight because you're fasting or going keto on your in your program and you don't need to increase your dose because you're losing weight and you feel really great? Like, do you need a study to tell you that that's okay to do? It's very comical. And you know, this is the dilemma. You know, this is the problem. Nana, if you live in the UK, you can still join our coaching program. Yes. Yeah. So you don't need to stay keto for the rest of your life, Anna. I agree. I'm actually with you. I actually agree that maintaining a ketogenic diet for life is challenging. I agree. I think I think that if we can get keto for a couple months and make some improvement in your insulin resistance, lower those chronically elevated insulin levels, then I think we can get somewhere. I'm gonna go ahead and end my other live here on the other page, so you guys can hop back on the main one. I'm still gonna stay live on my main TikTok page, just so you guys know. We'll see you later on this one. I went to go see your endocrinologist, and what did your endo say? When I do keto or fast, I get very low mood and depression. So bad it's hard for me to join. So, Karen, thank you for sharing that. And my initial thought would be that you need to there's some underlying metabolic or inflammatory roadblocks that's preventing your body from probably being able to shift metabolic states. And so there's an identifiable thing. Well, it's unidentifiable. We don't know what it is yet, but I have plenty of experience with working with individuals and figuring out what we can do to get them into the point where they can go keto or fast. So we don't know yet, but it's probably a bit of an adaptation. It's a bit of a process. Peptides like AOD 9604 can help as well. More the reason why coaching, guidance, structure, community, all of this matters, I think, to make sure that we're successful so that we have options. I just started my GLP-1 yesterday. Is coconut water good? I mean, coconut water compared to a lot of other sugary beverages out there, coconut water is low on calories, it's low on sugar. Still sugar though. It's low on sugar. Um, do you particularly really enjoy coconut water? Or are you just wondering if it's like an important food to eat? I generally say if we can avoid drinking calories. If we can avoid drinking calories, I think that's a good start. Of course, protein shake would be an exception. He told me to cut out carbs. I lost weight, but that was 8 months ago. Oh, good. Your endo actually supported a low carb diet. That's amazing. You actually rarely see medical providers that recommend that. So good for you. Good. That's awesome. What are my thoughts on carbonated water? Um, do I see any problem with carbonated water? No. Do I think you should I would still stick with regular non-carbonated water as your base of hydration. If you wanna throw in some carbonated beverages because it switches it up for you and, you like that, some sparkling water, sure, but I would still make regular water your base. Sometimes you just have to take an electrolyte supplement. Sometimes you have to take an electrolyte product, um, especially when you're going keto or you're going carnivore for the first time. I think it's important to make sure that you get enough electrolytes, and so I take a electrolyte supplement in the morning. Wegovy trials to 7.4. I'm not sure what you meant by that. Wegovy to the dose, 7.4 milligrams? Are you sure Wegovy's maxed out dose is 2.4. I've lost a lot of weight now struggling to not have carbs, have put some weight back on. Yeah, so this is where our coaching can come into play because helping you maintain stability in your life. Figuring out what combination of lifestyle interventions to help you achieve stability as an individual yourself. Can we still eat can we still have healthy carbs on this plan like fruit, potatoes, and sourdough bread? Um, so my goal with patients is to get them back to something that's sustainable. And so eating carbohydrates in some amount is probably more sustainable for most people. And so getting you back to a diet where you can have some fruit, maybe a little sourdough bread here and there on the days that you're lifting, I think that's pretty reasonable. But we have to get you insulin sensitive first because when you're insulin resistant, it's challenging to navigate, it's challenging to get results. And so this is why I'm in the beginning of the program, fasting and low carb, fasting and low carb. That's where we start. I've been on phentermine for 2 years. Yeah, phentermine long term is not ideal. Phentermine long term is not good. That's a harsh medication. Um, the data is very clear that it's short lasting effect anyways for a couple months, and then most people just kinda flatline on it. Good morning, Misty. Good morning, Miss. The fasting time frame. So for me, optimal fasting flow, guys, remember what I created is the flow protocol, FLOA, fasting like our ancestors. I created structure where structure was missing in the world of prolonged fasting. Good morning, Don. And I think the proper human lifestyle needs breaks from eating, especially when you're obese, especially when you have metabolic dysfunction. When you're suffering from chronically elevated insulin levels, start to lower your insulin. It's such a basic concept that when you're suffering from chronically elevated insulin levels, lower your insulin. You would think it's just standard practice, but for some reason, most registered dietitians will tell you carbohydrates are okay. Eat your carbohydrates. I get into arguments all the time. I would say clinical discussions, if you will, professional disagreements. My husband was reading and telling me all about peptides for pain and healing. Yeah, peptides are great, Miss Lisa. BPC 157, thymosin beta 4, or TB 500. These are the Wolverine healing peptides. We got you covered too with high quality healing peptides, guys. If you're looking for musculoskeletal healing, shoot us a message. Get yourself scheduled for that consultation. Wendell says, I'm on the Skittles diet. How's that working for you, Wendell? How's the Skittles diet working for you? Could you lose weight on Skittles? Sure. Is that leading you down a path of permanent weight loss and maintenance? Probably not. But you get to taste the rainbow, so I don't know. I mean, what's more important? Veronica struggles with insulin and PCOS, did great for 6 months, but then stalled over the last few weeks. So, Veronica, we are here to help you navigate this tricky area called weight loss stalls, metabolic dysfunction. Um, this phone number right here, guys, if you just joined us, welcome, welcome. And, you know, MBAD, do you think I guess let me ask you a question, MBAD. Are you excited about taking larger doses of medications? Do you think more medication is the path towards resolution? Now, medication when necessary, absolutely. Like, you guys know how I feel about this, when you need it. But do you think we should be focusing on other strategies first before increasing the dose for lasting weight loss? Do you think there's ever gonna be trials that are ever gonna be done looking at low dosing methods? Like, do you think that's ever gonna be researched? Do you think the pharmaceutical companies are gonna sit there and design a research trial? "Hey, can we keep people on a lower dose? Like, let's study that." Oh, man. So just be careful when you see studies that are done fueling the narrative and the agenda, which is lifelong medication. I mean, hey, it's perfectly healthy and normal to have your diabetes medications, your obesity medications, your antihypertensives and blood pressure medications, your cholesterol medications. Your average American is on freaking 4 to 10 different meds. That's healthy though, right? Good job. We're doing great. Or maybe there's a narrative and agenda that's being fed here. You're welcome, Purpose Flower. Guys, if you have a local doc that you're working with, and especially if you can get your insurance company to cover this, great. Get your insurance to go, get your medications there. Come to me for the coaching. I'm all for this. I think this is great. I'm doing a reset. I've been off tirzepatide for 4 weeks. You think it's enough? I can start again. So I can't give you specific medical advice on this live, but I can tell you if you're working with us in our clinic, like a 3-week break is pretty good. A 3-week break is amazing. Christina, is that Christina Matthews, or is that a different Christina? That is the one and only Christina hopping in. Uh, we got about 5-ish to 10 more minutes before I hop off though. So you did catch the end. Life's journey. I didn't see your question on YouTube. I cycle between 1,200 to 1,800 calories. I usually stay under 50 carbs. First of all, that's pretty low on intake. You're on Monjaro 7.5. Yeah, so life's journey, you're in the exact situation that I've been talking about all morning. I'd love to work with you. I'd love to get, you into production here and do some labs and fix this issue and get you on a lower dose. How do you know when you're losing muscle? That's a great question. How do you know Wendy says, "I'm a medical doctor. The only way the only way to lose weight is to stop eating." Uh, yeah, Wendy, that's true, but let me ask you, Wendy, as a medical doctor, what do you think controls eating? Like, whether a person can stick to eating less over time. What controls that? Is it 100% within the mindset of a person, or does that just put us back into the not last 50 years of telling people, "Stop eating, get out there and start moving, that's all you gotta do." Or do you think maybe there's this really complex pathophysiological, um, well, physiological, pathways in the body that drive hunger and food chatter and control your metabolism? Is there possibly a dysfunction in fuel partitioning in the body? Is obesity a disease of your body not knowing what to do with the energy? Because when you eat, there's so many different things your body can do with fuel. It could burn it. Your organs can use it. It can produce heat. It can go to various organs. It can store body fat. So when I look at obesity, this is a dysfunction in fuel partitioning. So yes, on the short term, the energy balance, the law of thermodynamics is not broken. but we have to have a deeper understanding and understand the nuance that goes into, well, what does your body do with the energy? Fixing the fuel partitioning dysfunction is why we ultimately say calories don't matter, because the bigger variable here that's really driving this problem is this dysregulated fuel partitioning. The toxic foods, the stress, these all drive and contribute to elevated insulin levels. Guys, before I hop off here for today's live, uh, this number right here is the best number to reach out to my team. Um, I know a lot of you guys are struggling. I know a lot of you guys are stuck. You're stalled. You're on maxed out doses of these medications. Listen to me now if you haven't listened so far. Do you think staying on a larger dose of these medications long term is is good for you? If there was a solution to get you off of those larger doses and get you back into weight loss, wouldn't that make more sense? Currently, right now, in the healthcare space currently in the healthcare space, the narrative is simple. Obesity is a chronic, irreversible disease that requires medication, and that's the only solution. That's the narrative right now. You know what I think? I think bullshit. Oh, yes, sorry. With the muscle mass question, uh, let me finish what I was saying, and then I'll get to that. So anyways, guys, this number right here, shoot us a message, get yourself scheduled for that free consultation, guys. We're gonna help you kick some ass. We're gonna help you do this right. Um, as you're losing weight, how can you tell if you are losing muscle mass? It's not easy. If you're lifting weights, you can look at your strength. If you're losing weight, but you're lifting, ideally, you should be maintaining your strength to a certain extent. You're gonna lose a little strength because inevitably you're gonna lose a little muscle mass. It's not easy to prevent all muscle mass, although it's possible, totally is. You gotta be really dialed in, and then you gotta have things like testosterone and growth hormone potentially to really help. Alicia, I'm definitely looking forward to helping you, but paying attention to how your body looks, pictures of your body front, side, and back every 2 weeks, objectively looking and comparing and seeing areas that have muscle, because if you're losing weight and maintaining muscle, you should see increased definition. Now, areas that the muscles are you can already see the muscle through the fat and skin, those areas should become more defined. You have to understand which areas of your body you're looking at, though. As a woman, your stomach will become more defined sooner than a man will. As a man, your arms will become more defined before your stomach will. So paying attention to those areas first and seeing if you can see improved muscle definition is very subjective, but still the best we can do. The only real accurate way would be body scans, hydrostatic or DEXA, to give you an objective measurement of muscle mass versus fat mass on your body. Of course, those are not practical and they're very challenging. So, anyways, guys, I'm gonna hop off this Sunday. Go Bills! Uh, Pretty sure the Eagles can pull it out too as well. I don't have any considerations there, but uh, I think this is. I know a lot of you guys probably have been watching me for quite some time. So just so you know, make sure you follow me on YouTube. Make sure you follow me on TikTok. These are my main platforms. If you're not ready to coach with us, if you're not ready to take the plunge quite yet, we do have a ton of free resources. I welcome you into the fam. into the Flow Academy membership. This is my platform to provide you guys with insights and value and strategies and motivation. And so shoot us a text message if you wanna learn more. I think those in-body scales are moderate at best. They're moderately accurate at best. So, alright, guys, happy Sunday. We'll see you guys later.